Singapore is making a move from tracking the number of COVID-19 vaccine doses to an up-to-date vaccination regime. Now, for more on what this means, we have with us Professor Ooi Eng Eong. He is Professor of Emerging Infectious Diseases at the Duke-NUS Medical School. Good evening, Professor Ooi. Thank you for joining us. All right, so it's been quite some time since many of us who are vaccinated have had any kind of injection at all. So tell us what it means by having this up-to-date vaccination regime in layman's terms, if you will.
Well, thank you for having me. I think what we know from the vaccines that we've received so far is that it actually protects us very well against severe disease. Amongst all those of us, the majority of us who have a normal immune system. Now, of course, there are some segments of our population that may have immunocompromised conditions or may have immune system that are weakened from disease or treatments from all these other chronic diseases. So they may require more doses. And perhaps in particular, the more up-to-date vaccines against that target the variants. Now, I think the 3 doses make sense because I think that's what the data shows. That's what all of us will need. Now, when it comes to this 4th dose and how many other boosters do we need, that pretty much depends on one, the virus that's circulating at that time or the variants that will emerge, as well as the person, whether the immune system is in top shape or whether it needs additional support. I think that's what it is. That's what's meant, and that's what's pragmatic for us to move forward.
But Professor Ooi, what you mentioned, so 2 things, virus circulating and the person's individual immune system. Well, these are very individual things, but what we're hearing is there will be up-to-date definitions to determine, or a new definition to determine if a person is up-to-date. So I presume there will be a national standard for my age group, for your age group, for anyone's age group, whether we are up-to-date. How will they know my personal immune level? How will they be able to come up with that general guide?
I think the easiest way, of course, is that there are clear groups, right? Where, say, for instance, those who are above 70 years old, 80 years old, I think there's no question there. For those who have, on anti-cancer therapy or immune therapy for various diseases, again, there's no issues there. But I think when you start to go down the age group to the adults and children, who are majority of us are going to be healthy, then there are a lot of areas where you cannot provide a blanket rule and say, anyone above 50 years old, this will apply as well, because then, you're going to subject a lot of people who perhaps may not fully need another booster shot to all the unnecessary jabs that they would be receiving. I think that's where the doctors will have to come in, right? So in some ways, that having a conversation with a health professional, if in doubt, would make a lot of sense in those situations. But there are clear groups where there'll be no question. I think those who are above 70, 80 years old, they should get their boosters.
Prof, these changes to the vaccination regime, they're coming at a time when the public will have seen that COVID numbers, in fact, are rising. The average daily infections, in fact, rising from 2,600 a week ago. We're looking at around 4,700 today, up nearly 5,000 daily. Is it too soon to sort of be thinking about completely dropping all safe management measures in all settings? At most places, rather. Right now, we still do have them, of course, for healthcare facilities, public transport, and so on.
I think it's the right time. It has been the right time for Singapore to ease back on some of the measures. And a lot of that's largely because the majority of our population, in fact, well over 90% of our population have been vaccinated. And not only that, some have actually also acquired COVID that now gives us, the hybrid immunity that the scientists have talked about, right? Which is arguably the best form of immunity that we can ever have against COVID-19. Now, even the best form of immunity will not protect us from becoming infected and develop mild disease. What it will do very well is to prevent us from getting severe disease. And that's why, although the numbers have been going up, and it will cycle over time. And even right now, as it's gone up, the number of ICU cases, so the very severe end of the spectrum of illness, has stayed very, very constant, right? So in other words, there's almost like a decoupling of the trends that we've seen in 2020 and early 2021, where when the number of COVID-19 cases go up, or the number of people who test positive for SARS coronavirus 2, then the number of severe cases in the hospital, particularly those that need the ICU, will also go up accordingly. Right now, that trend is has been decoupled, so that even though the overall cases in the community may go up, the number of patients in the ICU have remained very steady.
I mean, thankfully, we continue to sort of make this slow and steady progress with living with COVID-19. Professor, thank you very much for your thoughts this evening. That was Professor Ooi Eng Eong from the Duke-NUS Medical School.